Hello, I am not a doctor, I am not a medical professional. With that being said, let's move on to the video. I'm going to be talking about RU58841. And most of you, I'm assuming if you're on this video, you know what this drug is. You've probably been looking into it, but I have a new input I want to share with you guys today. So, RU58841, I'm just going to refer to it as RU because that name is super long and annoying. It's a topical anti-androgen, so what it does is you apply it topically and it competes with DHT for your androgen receptors in your hair cells. And as you know, DHT is responsible for hair follicle miniaturization, so that's why this is an effective treatment. The mechanism makes sense and the results show for themselves. This is an effective treatment, but however, there's not really human data on it. And because there's not human data on it, we have to look at anecdotal reports. If you are taking this, you are a guinea pig, you are a test subject, you are experimenting, and there's no shame for that. I mean, props to you, you have more balls than most people, and that's a good thing. But we do got to look at the anecdotal reports, and as effective as this treatment is, there is an interesting phenomena that occurs, and that is there's heart issues, chest issues, and you could just go to Amazon where you could see the product and open up like an Amazon reviews comment section on the product, and you'll realize that it's it's not just one person complaining they're getting like a tight chest or chest pain, increased heart rate, whatever, just heart dysfunction, endothelial dysfunction, and it's sort of common. Like, I don't have the metrics on it. I don't know how common it is, but it's certainly like popping up every once in a while that people are getting this issue. And I think I understand why today, because I'm gonna run this. I've decided, in a hypothetical situation where my DHT levels become elevated sometime in the future, I am going to be running this. So, I'm looking at these comments, and one thing I noticed is there was this one, it was like this bald boomer, and he was complaining. He's like, I'm running finasteride and minoxidil. I go on RU, and then all of a sudden, I'm getting chest pains. It's terrible. I hop off. This product sucks. And it's, there's a few comments like that, and you'll find these anecdotal reports, and we don't have human data to work off, and we gotta be safe, right? Like, we're gonna blast it, but we gotta be intelligent with it, right? So I was trying to boil down what's causing this, and I think I figured it out, and I'm gonna explain it to you guys right here. So, that guy said he was on finasteride, and I'm assuming a lot of these people that take RU come from these male baldness forums, and it's safe to assume that anyone trying an experimental drug is probably already stacked with tons of other medications like 5-alpha reductase inhibitors such as Dutasteride and Finasteride. So think of it this way. You have people that take a DHT blocker. And let's go back a bit. So we know if people are getting heart issues, we know that either this is a topical treatment. We know that some of it's getting into the bloodstream through the skin, and those anti-androgens are binding at the heart, at the endothelial layer. We know this is happening because we're getting those reports, and if we trust those reports are legit, which are quite common, they probably are, we have to assume that. So if we know that anti-androgens in the blood are increasing, why the hell would you nuke DHT? Think about it, okay? Because DHT is competition for these anti-androgens. That's what the competition is. If you kill all the competition by killing all of your DHT or most of your DHT, what you're doing is you're allowing these anti-androgens to become more effective in your body. Even a small amount, if they enter your bloodstream, they become more effective. And that's why they get into your heart. And that makes sense completely. That's stupid. It's like if you're playing tug of war. Think about this. You have 100 men versus 1 man in tug of war. You're going to no homo, but you're gonna drag them across the fucking field because it's too much. There's too many men. That one guy can't compete. So if you dilute the DHT in your body, to use for a better word, if you have a higher ratio of DHT to anti-androgens in your body, like those anti-androgens are going to have a very little effect. However, if you shoot 99 of those fucking men in tug of war and all of them die, and then it's a 1v1, like that one guy is going to be way more competitive and have a better chance to win. So, like, you know, we have to work in theory here because theory is all we have. And, like, yes, theory can only take you so far, but it's all that we got, and we have to use it. And, you know, from this, like, just viewing it this way, I think that might be responsible for people having heart problems while using RU. So, I mean, if I were you, I'm going to be doing this. This is not financial advice. This is not medical advice. This is not advice. You should not do this. I don't know what I'm talking about. But when I do run RU, I am not going to be fucking with DHT blockers. It makes no sense. You just gotta high dose it and use it topically, and just try to stay away from nuking your DHT, because if you nuke your DHT and a little bit becomes in your bloodstream, it's going to be way more effective with no DHT. You're basically killing off all the competition, and it's just going to thrive in your body. So I just want to share that. I saw no one talk about this, so hopefully you learned something today and maybe you'll use it.